Explain evidence-based approach with appropriate example. First, in the introduction, evidence-based approach is the process by which nurses make clinical decisions using the best available research evidence, their clinical expertise, and the patient preferences. EBP എന്ന് വെച്ച് കഴിഞ്ഞാൽ എവിഡൻസ് ബേസ്ഡ് പ്രാക്ടീസ്. EBP involves ability to assess, summarize, and apply information from the literature to day-to-day clinical problems. Evidence-based practice can be thought of as integrating individual clinical practice with the best available external clinical evidence from systematic research. Goal of evidence-based nursing. It is to apply valid and reliable nursing research to clinical practice. Individual nurses have the primary responsibilities for evaluating and promoting evidence in the context of their practice to ensure that nursing practice maximize health and quality of care from the client's perspective. The need for evidence-based nursing practice. EBN is one approach that enables further health care providers to manage the explosion of new literature and technology, and ultimately may result in improved patient outcomes. Nursing students spend a great deal of preclinical preparation time designing care plans, reviewing pathophysiology, rationally, and memorizing pharmacological interactions. Only depending on textbooks and expert faculty knowledge does not promote the critical thinking skills that must have to survive in current fast-paced clinical setting. Students must learn to develop independent, evidence-based methods of clinical decision. Evidence-based practice allows nurses to enrich their clinical training and experience with the update research. Then, research of also steps of evidence-based approach or practice. First, step 1 and then selection of the topic. Then, step 2, form a team. Step 3, evidence retrieval. Step 4, apply the evidence. Then step 5, decision to change the practice. Decision to change the practice. Then totally 5 steps ആണുള്ളത്. First step 1 and then selection of the topic. Ideas come from different sources which are categorized into 2 areas. Problem focused triggers, knowledge focused triggers. When selecting a topic, nurses should formulate questions that are likely to gain support from people within the organization. Problem-focused triggers. It is identified by healthcare staff through quality improve, risk surveillance, using data until recurrent clinical problem. The knowledge-focused triggers. They are created when healthcare staff read research, listen to scientific papers at research conferences. For step 2, form a team. Forming a team increases the chance of EBP being adopted. It is also important to consider interdisciplinary involvement to decrease rejection and for all to have an understanding for the project. Next, the EBN team should have explanation that clearly define the types of patient setting, outcomes, interventions, and exposure. Step 3, evidence retrieval. Here is a need to from a clinical question so that an appropriate literature review can be performed. An acronym used to remember. This is called the PICO model. P, patient population. I, what is the potential intervention or area of interest. C, is there a comparison intervention or control group. O, what is desired outcome. Apply. First step 4, apply the evidence. A decision is arrived at whether the information gathered does apply to the initial question. Next, the information gathered should be each other with other nurses, art or fellow researchers. Then decision to change the practice. When the studies are completed and the EBP outcome are evaluated, a decision is reached on whether to use in practice. Then several factors are put into consideration. First, relevance of evidence, then second, consistency of finding across studies or guidelines, then strategies for implementing evidence-based practice. Talk with the colleagues to identify challenges providing care, ask questions about agency practices, ask about the research evidence underlying agency practices, identify clinical practice problems, join a professional and specialty association to have ready access to the latest news, research, and standards. Then subscribe to journals that have synopsis of clinical research evidence. Then sign up for alerts from key agencies for research and patient outcome news. Start a journal club for discussion of research articles. Then examples of EBP. There are many examples of EBP in the daily practice of nursing. Infection control. Nurses play a key role in helping to prevent illness before it happens by adhering to evidence-based infection control policies. This includes keeping the healthcare environment clean, wearing personal protective clothing, using barrier precaution, and practicing correct hand washing. Next, oxygen use in patient COPD with the COPD. For patient health and safety, it is essential that nurses follow evidence-based practice in nursing when it comes to giving oxygen to patients with COPD. Despite the belief by some that providing oxygen to these patients can create serious issues such as hypercarbia, acidosis, or even death, the evidence-based protocol is to provide oxygen to COPD patients. This practice can prevent hypoxia and organ failure. Giving oxygen, which is correct treatment based on the evidence, can enhance COPD patients' quality of life and help them live longer.